what can we do, or what types of things will we see with people having trouble breathing?
Yep.
Like that, really, when it comes down to it, trouble breathing is the kind of starting point of respiratory emergencies.
Dysfunction physiologically of the lungs and how they're working.
It is dyspnea. So the clinical meaning for dyspnea is that it's not just it's not a disease. It is a symptom, right? It's usually a symptom of something bigger, something that does need to be addressed. It may need an intervention, but the symptom of dyspnea is not a diagnosis. Dyspnea is subjective, having difficulty breathing.
Mm-hmm.
That's up to them to figure out.
And here's the thing, like, you can have very few signs of dyspnea, other than the fact that the patient is saying, I'm having trouble breathing.
Right.
I'm short of breath.
Right. But dyspnea being kind of this overall term for somebody feeling like they just cannot get enough air.
Right.
Right.
Like they're having trouble breathing. Dyspnea has a few causes. Well, actually, it's got a lot of causes because it can mean a bunch of different things.
I mean, you can be the best on-hand skill person, but if you can't pass the test, you're not going to get registered to do the skills.
You know, that's those. What are you looking for, Jonathan, when you're out in the field for breathing emergency? Because it's the A, right? The A and the B. First two in the ABCs are airway and breathing.
It's one of those things that if we don't take care of these respiratory distress patients aggressively, it leads to really poor outcomes for them.
Yeah.
So if you notice something, if you're listening and you're like, you start to notice some sort of issue, you should kind of go down the path of that respiratory distress and figure out what your next step in taking care of this person is, because it's the difference between them being able to talk to you maybe through some, broken speech because they're having shortness of breath, and them getting intubated at a hospital. So really, really just be on top of it when we come to respiratory emergencies.